guys? Welcome to Blessing Capital YouTube channel. I'm your host, Joshua Blessing. And on today's episode, it is absolutely mind-boggling. We're interviewing Dr. Tim Harrigan, guys, one of the top natural healers here in the Tucson area. This guy has helped over 10,000 patients receive healing through natural ways. And the crazy thing about it, guys, is the things that we're gonna show you today, the different treatments, they have never been shown before. And so we're gonna take you guys behind the scenes into some of these modalities. But another thing I want to share with you guys before we go inside is we're actually outside of his clinic, which is a natural health clinic. And then to the left of us is a medical clinic for testing. And there's hundreds of people out there testing, guys. And I don't know, I just thought we should share that because I think there's two different realities that we can live in. One's really, really heavy medical. The other one's natural health. And so we just want to give you guys the opportunity to learn each side. Dr. Tim Harrigan, Joshua Blessing, let's go. Guys, welcome. This is Joshua Blessing, and I'm here with my special guest, Dr. Tim, today. And we're doing a very, very special video with Dr. Tim, guys, because I know, and I know a lot of you guys know, that health and wellness is an intricate part of our success. So on the Blessing Capital channel, there's three things that we talk about. We talk about health and wellness, we talk about finances, and we also sprinkle it with a little bit of spirituality. So Dr. Tim, welcome to Blessing Capital YouTube channel.
Thank you. Appreciate it, man.
Thank you, brother.
Good having you.
Thank you. So a little bit of background, how I met Dr. Tim. I met Dr. Tim through a client of mine. One of my clients referred me. I've been struggling with migraines ever since actually leaving the military. So it was one of the big things that I struggled with was my migraines. And the one thing I loved about you was you were so confident that you could help me with my migraines. What I want to know is you didn't do any medication. You didn't give me any shots. Your technique and modality was very specific, but it helped me and it got me relief really, really fast. So can you kind of just tell us a little bit about your background and what kind of doctor are you?
Sure, yeah. First of all, thanks for putting trust in us. Your family's amazing, so we try to only accept amazing people anymore because, we really want to help the world without using drugs and surgery, basically. So right. I've become obsessed over the past 20 years with really learning cause and effect of the human body. Everything around us in this room right now, outside, our foods we eat, really affect our health and our well-being. And so, as you know, I mean, you can have all the finances in the world, but if you're not healthy, you can't enjoy that. You can't, hang out with your kids or do your hobbies or, help other people as well as we can. We can't serve if we're not healthy. So I've become obsessed where I haven't had a prescription in over 20 years. Right. Our practice, it's a natural healthcare practice. It's really designed to basically have people not rely on drugs and surgery, and we've gotten really good at it. So we do lots of tests, blood work, hormone tests, EMGs, thermal scans. Of course, we send out for x-rays and ultrasound and MRIs and things, but the goal is to address the cause of the problem. And we all know with a headache, for example, the cause of a headache isn't a lack of Tylenol, right? It's not a lack of ibuprofen. It's not an ibuprofen deficiency. There's a reason why. And so just a headache, for example, there's 100 reasons why we get headaches. Right. So my job, what I've learned to become obsessed with is figuring out how and why that's happening in your body so we can address that. So, I've literally had patients that had headaches that it was because of a brain tumor. That's one reason why people get headaches. Now, we don't assume everybody has a brain tumor if they have a headache, of course, but some people could get a headache because of dehydration or a tight muscle in their neck or their sleeping position or because of certain foods they're eating or because of a hormone imbalance or because of this or that. There's 100 reasons, but we have, 4 or 5 or 6 medications to treat a headache, even though there's 100 causes to headaches, right? So that's what we've gotten obsessed with. So my children haven't literally had a medication in their body yet at all. I have 4 kids, 10 and under. Wow. My wife was actually told she would never have children. She had PCOS, endometriosis. She no longer has those complications anymore. So it's pretty cool. We're just constantly looking for better ways using lasers and blood work and food sensitivity testing and heavy metal testing to really address my physiology that's so complex. People don't realize it's not as simple as let's go take a vitamin from the grocery store to get healthy. It doesn't work that way. There's over 30,000 billion chemical reactions in our bodies in 1 single second. That just happened in 1 second in our body, 30,000 billion. So that happens every second, every day of our life. So our brains can't even comprehend that number, first of all. So we want to step back, use a lot of common sense, and really address the cause and foundational reasons as to why my body gets out of balance. And so migraines is really no exception to that. So
interesting. Thank you for that. Well, that was very powerful. Thank you for that. And so let me ask you this. Does everyone have to approach health a little bit differently when it comes to natural health? Or is there some foundational principles that you would just kind of recommend for the people?
Yeah, very good question. So there's no cookie cutter program for everybody. However, there are some fundamental things we all have to have in place. Okay. So your nervous system, we can all agree, if I fall off a horse like Christopher Reeves, right? From 6 feet high, and that was it, broke his neck up here, lost all function below that area. So we can all agree my brain and spinal cord, literally the most important system is the central nervous system. Right. So first of all, we have to take care of that. And how many people do you know that actually go out of their way daily or even weekly to take care of their nervous system? People don't do that, right? People wait for the heart attack, right? The first symptom, usually the very first symptom of heart disease, which takes 10 to 30 years to occur, usually the first symptom is the actual heart attack itself. Half the people are dead from that, right? Wow. Half the people, hopefully it wakes them up to start making better choices, but that's the first sign that they have heart disease, that they notice, right? So we can't just give you a quick pill and then get rid of the 20 years of heart disease. It doesn't work that way. Right. So function is everything. So we want to look at that and really just address, again, the cause of the problem.
So function is the key part?
Function is everything. So the nervous system, structure, just a basic structural thing. They say for every inch forward your head goes from your center of gravity, you add 10 pounds more pressure, which is part of where migraines come from too. You have all this tension back here, putting stress on the nerves and ligaments and everything else. It's like holding a bowling ball close to your body, which is much easier than if I start holding it out here, right? It puts a lot of stress on the soft tissues. Right. So structure, nervous system, hormones should be in balance in all of us. Blood work should be nice and clear throughout. Shouldn't be super high, super low things. So that's the general idea, what everybody needs help with. Okay. There's certain fundamental things. But now if we get into customizing stuff, if I do a food sensitivity on you, a food sensitivity test on you versus me versus somebody else, we're going to have different foods we're sensitive to. Right. So that's where the customization comes in. You have certain deficiencies that I don't have. Right. I have certain deficiencies you don't have. I have certain toxicities you don't have, vice versa. I have other imbalances. There's really technically 3 things that happen in the human body. Deficiencies, which is not enough of something, whether it's vitamins, minerals, macros, whatever, water. Toxicity, which is too much of something, which could also be water, right? If you drink 3 gallons of water, that's toxic. But also chemicals, foods, prescriptions, other things in our environment, personal care products. So that's a toxicity. And then we have imbalances such as hormonal. So there are certain things that all of us have to pay attention to, but there's no cookie cutter program for everybody. All of those different tests that we do are going to lead us into different things to help that individual person. So if you give me, 20 people that get headaches or migraines, they all literally have different profiles, right? Even though we call their symptom the same thing, we can't treat all 20 people the same way. It's impossible.
Gotcha. The approach has to be different for each individual.
Because you have different deficiencies than all the other 19 people in that group, right? You have different toxicities. So we take those people and literally just get them more healthy. It's very simple. Yeah. When I get you more healthy and we get those 30,000 billion chemical reactions that occur every second in my body, more balanced, closer to homeostasis, does it matter the name of a condition if I get you healthy enough? Right? So we don't want to just diagnose people because, again, if I diagnose 20 people with migraines, that's great, but I fix them all differently.
Gotcha. So every approach would be different with a migraine. And so I know there's so many people out there right now struggling with headaches, migraines. They're struggling with weight imbalances. And I would like for you maybe just to touch base on, if they're not in Arizona, just so you guys know, we're in Tucson, Arizona with Synergy Wellness. This is Dr. Tim Harrigan for you guys that are just tuning in right now. And incredible guy. Like I said, he's literally helped me heal my migraines, and it's a work in progress, and we continue to stay on that path. And since I've been staying on that path, I haven't gotten off track, which has been nice.
That's awesome.
So I want to ask you, for people who are not maybe in Tucson, how do they find somebody like you? It was so, with you, it was so interesting. I found you through a client of mine, somebody I trusted, so it was a very easy transition. But how does somebody find somebody like you? What should they be looking for?
That's a very good question. We get that question weekly from our patients, whether they move or they have a family member somewhere else and they want to get them the same care. Well, it's a tough question because everything we do in our practice, we use lasers, we use 10 different, chiropractic techniques. We teach people how to stretch and exercise and eat properly. We do anything you could think of. But when we find out through these medical tests what somebody needs, we don't use drugs and surgery to fix it. We don't have to. So we've gotten really good at finding, again, the deficiencies or toxicities there. So when we send somebody, or if somebody moves away and we have to try to find them somebody maybe in a different state, it's challenging because all the stuff that we do here, it's because of my obsession with going to seminars, going to Tony Robbins, which you're familiar with.
Shout out to Tony Robbins.
Shout out to Tony Robbins. But just medical conferences, chiropractic seminars, nutrition, seminars, anything and everything. I just want to wrap my mind around it all. And some of it's not useful, but that's also reinforces what we're doing sometimes is what we don't want to do, right?
Right.
So it's tough, but I guess the best advice is, work with somebody that's not, it sounds weird, but not specializing in just one thing because that creates tunnel vision, right? If I go, not saying don't go to a cardiologist, but if you go to a cardiologist, his job, he's trained to look at the heart. But consider this, what in my body, what systems in my body affect my heart and cardiovascular system? Every other system does, right? So if we're not looking at the immune system at the same time or the nervous system, which controls everything, or my hormones, which can affect my heart rate or whatever else, we're missing the big picture because that's how our body functions holistically is all these systems are interacting. So ironically, in a lot of schools now, they're teaching systems biology, not these separate systems. You can't separate the nervous system.
So they have a more holistic approach to it all?
Exactly. They're trying, yeah.
That's
so
interesting.
we can't isolate systems is what they're realizing. You can't affect one system without every other system being affected to some degree. So we have to look at everything together. So I guess the best advice is look for people that are looking at the big picture that might do blood work as well as work on your manual therapy needs that my body might need for my structure nervous system, that might also have a network of massage therapists and acupuncturists or clinical nutritionists. So somebody that's going to look at it all together, an integrative type doc that's not going to miss a system and just focus tunnel vision on one thing. So.
And I think what we really want to say to the people is try to find that holistic approach. We think that's so important is to try to find something like you specialize in, Dr. Tim. No surgeries. He didn't
There's
cut
a time and place, right? I don't want to say drugs are never necessary, surgery's never necessary, but 99% of the time in my experience, they are unnecessary. And we can find another option that's safer, less side effects and things. So, I want to make sure people don't think that we're trying to tell them to get off their drugs or, don't get a surgery, but it's, I would say at least 99% overutilized.
But would you say at least them try to, if they're noticing that they need to change some stuff in their life and they're not sick, let's say they're not really overly sick, they're not in a place where they need surgery and they just want to feel better and feel healthier, try a natural approach.
Absolutely.
Go to an acupuncturist, maybe find a chiropractor. One thing that Dr. Tim specializes in, guys, which was amazing, I'm even trying to fix my posture right now as I'm talking to you, is the spine. Can you talk just, I know you did talk about the spine a little bit, but why taking care of the spine can open up a world of possibilities for your wellness? And I know you did touch about that because there's neurological effects of the spine, but maybe we can just touch base on why the spine is so important.
Yeah, absolutely. It's the most important thing, right? Because without your spine, you can't live with just a head, right? You can't live with just a body. You literally have to have the central nervous system intact. Again, if I break my neck up here, I can paralyze myself from nothing works below that level, right? So the spine, ironically, is one of the most important things that we should look at least monthly, if not weekly, because all of us know about, going to the dentist twice a year, right? Well, guess what? If your teeth and my teeth fall out tomorrow, we can get all new gold ones if we want, right?
That's true.
You can replace that. Your spine, this is crazy, is absolutely irreplaceable. We get one shot with it. There's no such thing as a spine transplant. If your knees go bad, if your shoulder goes bad, we can replace those all day long and even do a double transplant later on or a triple sometimes even. So
you can transplant your heart. You can do that. You
exactly. No such thing as a spinal transplant, though. We get one shot with it. So here's the problem. Just like going into the heart attack example where it takes 10, 20, 30 years to get to the point where I do have the heart attack, but it's a 10 to 20, 30 year process, the first symptom is the heart disease. So most people, ironically, don't start paying attention to their spine until it hurts. By the time it hurts, that's like waiting for the heart attack to now reverse my 20 years of heart disease. That might have thinning discs, which we can help those to some degree, but we're never going to be like when we were 8 years old again. We can't get them back to 100%. You might have bone spurs. You might have thinning cartilage. You might have ligaments that are hardening. You can't do much with that once that process takes effect, right? Now, unlike heart disease, if I do have a heart attack, I have a patient actually, phenomenal story. He had a heart attack 15 to 20 years ago, and he's taken on this natural approach when he was told he'd be on statins the rest of his life. I didn't get him off those, by the way. That was his other doctor that did that. But he was told he'd be on all these very invasive drugs for the rest of his life. He's literally lived 15, 20 more years after the heart attack, no medications.
Wow.
He's in control of it with diet, exercise, nutritional, very powerful therapeutic grade supplements and things like that. So, but the spine though, it's irreplaceable. Once that degeneration or arthritis or spinal decay or, the disc degeneration happens, you can only improve it so much at that point. So we get one shot with it. So just like we go to the dentist twice a year, people absolutely, it's more necessary to go to a good chiropractor, right? In every industry, there's bad everything, right? I've had bad dentists before, but find a good person that is looking at the central nervous system that will help you keep that process under control. The scary thing is the most common cause of disability, actually of somebody 50 or older, the most common cause is spinal related issues. Because again, we really don't pay attention to it until it hurts. And a lot of times there's been some silent changes leading up to that point.
Interesting. And you did mention something that I think is really important to touch base on is chiropractic. I have been seeing chiropractors for the last 15 years religiously, and they're all different, right? What I loved about your approach was it was so integrative. Not only did you put supplements and you put cleanses on top of there, but you also used laser therapy, you did massage, you did hot and cold therapy. So there was a whole full, approach to it. And also the adjustment chairs that you use is completely different.
Yeah.
The retractable chairs are just, guys, you got to see it. We will show you guys what some of the stuff looks like and what he's been using behind the scenes. It's absolutely mind boggling. So you just want to hang on just a few more minutes of this video because it's going to be crazy. But the one thing I did want to say was it's okay to maybe find a chiropractor who didn't initially work for you, but try to go find someone else because they're all different. They're all different. They all have a different approach. So just don't give up. I guess a lot of people think they should see a chiropractor after they've been to a car accident or something major happened. But I really want to encourage you guys to go see a chiropractor just for your overall wellness. Kind of just like you said, just a routine. So maybe just last question for you, Dr. Tim, before you kind of show us some of the modalities that you're using behind the scene footage that people have never seen before, unless you've been a patient of his, which is you got to go through a process, guys. It isn't easy getting to this office. And that's what I love about it. He makes it really, really difficult for you to see him. And that's good. I think that's awesome. But how do they find that right chiropractor? Like you said, your first chiropractic experience wasn't the most pleasant.
It was horrible.
It was horrible.
It was horrible.
So how do you find that right chiropractor and not give up?
That's a great question. So I think philosophies take us a long way. I know you have some strong philosophies, you and your wife. So do we in our family. I mean, we literally use the medical system as a crisis device, right? If we have an emergency, absolutely. I'm going to be the first person in the emergency room line. So it might sound like sometimes to some people that we're anti-doctors and anti-drugs. Well, no, we're pro-health. So if we can find other ways that are less invasive, this goes into your question where you want to really start less invasive. Then let's go through this pecking order where maybe the surgery or the drug is after everything else failed, right? But let's address the cause. So we don't start crazy and then try this later on, which we get that all the time. So we have people come in all the time that are, we really want to go natural first, let's say chiropractic, nutrition first, but that takes time. People are so impatient. We want a quick fix, right? If I give us all morphine in the room right now, we know the outcome. You feel great. You have zero symptoms. It's predictable. Nutrition, chiropractic, exercising, it's not like that. You don't exercise one time and look in the mirror and say, all right, I'm done. It doesn't work that way. It's consistency and daily habits, just like finances, as you're aware of. It's the daily habits that determine where I am today. So I don't know if that answered the question.
That answers the question a lot. And so basically, they may go see a chiropractor, they may go see a natural doctor or a naturopath or an acupuncturist. They may not get relief that immediate time, but if they stay consistent with it, they will start noticing those benefits. And that was kind of with my migraines.
Yeah, stick with the philosophy. The philosophy is what drives us. So it's like Tony Robbins says, it's how long would you give the average baby to learn how to walk?
Right.
What a silly question. You
Right,
make sure
that's
that baby walks no matter what happens, no matter how long
Right.
it takes, right?
Right.
So our philosophies really guide us. So if I want to be fit, you know, get a vision board, write your goals down, write your daily action steps for the next year to make it happen. But you don't stop just because you're not seeing results. You change your game plan. You see what's working, and you continue if it's working well, or find something that works even better. If it's not working, change your game plan. Just like an airplane going to New York from here, they're off track 95% of the time. You have to constantly look at things. Is this working or not? And change it. So the philosophy is really what's going to drive you to be the baby that's going to walk. Eventually, you're going to figure out a darn way to do it. And it's frustrating because, again, we have this happen all the time where people move. They're trying to find somebody like us, and it's challenging. So my best advice for that person is go to 10 different people, you know, try them out for a little while, see who resonates with you, see what their strengths are, see if you even like the person. You know, they may have a totally, you know, conflicting, I guess, personality as you. So really just, you know, just stick with the philosophy, stick with the goal, and navigate however you have to until you reach that goal or destination.
I love that. Guys, if you're in the Tucson area, please check out Dr. Tim Harrigan with Synergy Wellness. Thank you so much.
Of course.
Dr. Tim, thank you so much, guys. And we're going to now take you guys behind the scenes. Dr. Tim's going to show us a few of his modalities, and you guys want to tune in. So thank you. Damn. Whoa, man. Turn that thing's powerful, man.
So there's different frequencies in here. Certain frequencies
You didn't tell me you were gonna blast me like that, man.
that.
He blasted the shit out of me. Did you guys see that? That was crazy.
What's that?
That freak, you can feel it.
Oh yeah.
I felt it go through my hands. I felt it around my wrist where my stainless steel, you know, the stainless steel bends at.
It
I felt
affects
it
your
through,
mitochondria in your
I
body.
felt it all through my body.
Yeah, it's wild.
Oh
It's a
my
Tesla coil, basically.
God.
It's an energizing device.
So is that also
there's-
killing
there's-
parasites?
There's recipes for everything because everything is energetics. Everything is vibrating atoms and molecules, right? And energy, right? And Anna knows all about that. So this is literally just affecting all that quantum and cellular. So
I didn't know you were gonna
pretty
blast
wild.
me like that. And what about having like jewelry and stuff on? Is that
fine,
okay?
Yeah. Unless you like hand me one. You know what I mean?
Gotcha.
Yeah.
Holy,
Yeah.
you scared
If you have your phone up, it doesn't ruin your phone, but it'll like if you're on your phone like and it's open, it'll like scan through apps sometimes.
Wow.
It'll turn that on occasionally.
Damn. In a more
Well, you saw that light, so I wasn't even touching this, right? It was literally going
Yeah.
through my body.
As
I
a
do that for
premier.
the people that are skeptical of them. Like,
Dude.
people know innately that, you know, radiation and Wi-Fi that are bad for us, right? Most people know that now. An opposite energy that's good for you too that you can't see. So I use that to show people. It's like, this isn't voodoo stuff. This is real.